So, well, as some of you know, I work in Barcelona, in Hospital del Mar. Maybe for 25 years ago in mental health. So now I'm working with people with anxiety, mood disorders, and also first episodes of schizophrenia. And well, this changed a lot since March when COVID started. The assistants had to change and some things changed. So I want to share it with you. I like this picture very much because it talks about nurses and all the sanitary workers, like health professionals, who are them. It says that they are the band in Titanic that they are playing when everything is happening. So that's us, we are playing. So, well, first of all, some general information to share with you. As you know, COVID caused a lot of infections in the world, by now 25 million people, and almost more than 854, almost 855 deaths in the world. In Spain, it hits hard again as well. From March to May, there were a lot of cases, as you know, and we are still having a lot. More than almost 30,000 deaths in Spain, and a lot of infected too. But the thing that strikes a lot and shocks me more is that the 16% of these infections are professionals. So maybe there's something we are not doing well, because the 21% of professionals have been infected here. So at the beginning, as you know, there were a lack of materials, a lack of resources, a lack of professionals, a lack of spaces. Now this has changed. Governments are making massive tests to population, and we have all professionals now, we know what to do. So that's a good point. But from the beginning, it was an absolute chaos. So, well, we hope this tendency continues and this will get better. But from that time to now, professionals suffered from burnout, anxiety, depression, fear, anger, and some of them still have these problems too, me included. Okay. Talking about mental health, as you know, all the resources were concentrated to improve the COVID situation, but then they noticed that mental health is also important. So we had to face the problems with our users. As I told before, I work with people with anxiety problems. So as you can imagine, with this situation, the anxiety gets worse. Also mood disorders. So some of these people has worsened their disorder, but also people without these previous disorders had anxiety and mood disorders too with this time. So as well as users, usual users we had, and these families, we had to face mental health of people with COVID and families of people with COVID, and also professionals. About mental health nurses, the thing that is important for us now. Well, most of the professionals had to work in COVID units. So as you can imagine, if I work in mental health for more than 20 years, that it's very difficult for me to work in a general unit, because there are a lot of techniques that I don't remember how to do. So it's stressing for professionals. But other professionals, lucky me, we could do some mental health support to other professionals, to users, and to patients with COVID and families. I think it's general for everybody that is to feel fear in this situation, fear to be infected, fear of infect your family and the people you love. People who work in a hospital, it's so difficult because they have to come home after this. And well, it's so stressing. And what we had to do was to strengthen our roles. That changed, and we have to adapt. Well, I don't know if it happens the same in other countries, but we had some phases here in Spain at the beginning when we had to stay at home at first. Well, people tried to do some sports and do many things at first, but then after a few weeks, they felt very anxious again and with mood disorders because of, well, many people lost their jobs. Many people had economical problems. And well, the people I treated before with agoraphobia felt more fear of going out with the COVID situation. But also people without agoraphobia had fear. So fear of going out to the supermarket, of going out to buy to the pharmacy, and fear of infecting the family. Also anxiety of being closed at home because they couldn't go out, and it's sometimes boring. Sometimes you feel angry with people at home. Sometimes you feel alone if you are alone at home. And some people had to do telematic work at home. And with families, I think it's difficult. As you know, well, Spanish society is very open and very social. So it's difficult for all these people to stay at home without touching your family or without kissing or hugging friends. So I think it's difficult. About professionals, maybe it happened the opposite. So I think we worked more than ever. Some telematic work, but some others working at the hospital or in many places because nurses were required everywhere. With all this stress, because of the lack of information, the lack of materials, of resources, so it was very scary at the beginning. And there are some risks then after this of post-traumatic stress and burnout. Well, do you remember when at first everybody were at the balconies clapping for for nurses and doctors and health professionals? We passed from this to be bummed. So people think now that we are lazy, that we are teleworking because we don't want to work in the hospital. So there's a change, and it's a little bit frustrating sometimes. Well, let's talk about my experience. That's me. So I had to change the way of making assistance. First of all, because of the clothes I had to wear, because it's not easy to be close to the patient with this mask. They can't see your face, your emotions. You can't see their face as well. The distance within them. Sometimes virtual working, and the image is not very. It's scary. So when they come home, when they come to the hospital, it was difficult for them. The 80% of the Hospital del Mar became only units for COVID. So many people with other pathology, with other diseases, had to want to go home, and also mental health patients that were there. So they couldn't be attended as before. Here are some examples of what people said. When I work with people, they usually told that, for example, I've been working for 20 years in mental health, that's like me, and now my boss wants me to work in a COVID unit. I don't remember some techniques, I'm not able to do this. Or after working 12 hours in the COVID unit, I'm scared of going home to see my family, and I'm so tired that I only want to sleep. That was very common. I had a panic attack during my last turn. We had to decide who could leave and who could not. I have to telework at home with my child with autism. It's so difficult. I'm so stressed with this situation. I'm in an emotional roller coaster. I feel angry most of the day. I'm so tired. I'm scared and sad. I lost confidence with people. After 15 days, my father died and I couldn't go to visit him. I couldn't say goodbye to my mom a few hours before she died. She was alone because visits were forbidden. It's so sad. I've been here isolated for 3 weeks without seeing my family, and nobody explains me what's going on. I don't know if I will survive or not. I don't know how they are. Well, these are some examples of problems that we met. So mental health there's no health without mental health. So we had to do something about this for professionals, for COVID patients, for our usual patients, and for families. And that's what we did. So I gave support to my usual users, anxiety and depression users in the hospital, and also telematic work. Then also to health professionals. But as you can see, most of the problems are problems related to the resources and the system and this kind of thing. So what can I do with this? I don't have the solution. So just offering some relaxation techniques, active listening, some basic tips that they know, but it's okay that someone reminds them, and just being with them. Also giving support to COVID patients hospitalized or at home because they were alone at first. Then when we had materials for everybody, people could go to visit them, but in the first 2 months, they were alone. Also giving support to the families of terminal patients of COVID. That was hard because at the beginning, they couldn't visit this person at the hospital, and people died alone. And families were so sad because it was shocking for them. They couldn't say goodbye. And the grieving process was very bad at that time. After that, well, we went with them to help them and say goodbye to their families and give support in this grieving process. I think this was one of the most important support that I could give. Also help in the COVID unit, and well, all the classes I had to do were telematics with the students. And then there were many people and many places required nurses and doctors to give information about COVID on the phone, like emergencies units were collapsed. So I also helped that with that. So I worked almost 12 hours, 12 hours every day. It was a bit exhausting, but well, now it's more relaxed. So this is for us. How can we face our anxiety and depression? Just find the time to do some relaxation or do some sports, or look for some talk with colleagues and laugh with colleagues, and talk with friends, telematical or face-to-face, but talk with friends and family. Sleep well, and practice hobbies. I think this is very important for everybody, not for users, but for professionals, for everybody, to face anxiety and depression. To face anger, what we could do, because, well, this crisis showed a very, well, we had some criticism about the politics management and the lack of resources of mental health. This is Hospital del Mar, and we are demonstrating against some measures, some controversial measures. So I think it's good for us to express these emotions. But then there are the opposite. This is the deniers demonstrations, because we have to wear masks here everywhere. So these people don't want to wear masks and don't want to, well, they don't really believe that there's a disease called COVID, and that coronavirus is not that, that's such a problem. But well, just to finish, this is some nice picture to finish because Well, I think that sometimes the crisis improves our imagination, and maybe this crisis can be an opportunity to grow or improve things. So, well, there's an image of hope for the future. And I think I talked very, very quickly, but that's it.